If you are watching this, let me guess something about you. By now, you have probably seen 2 or 3 doctors, you have done your blood test. By now, you might have started taking medicines, you changed your diet, you started exercising, you cut down on sugar, you did everything what you have been told to do. But still, your periods are irregular, you are not able to lose your weight, your hair keeps falling, or you have been trying to conceive for months but nothing is happening, and every morning you wake up exhausted even after resting for 8 hours. And no one can tell you why. And the most frustrating part is your blood reports look normal, and the doctor looks at them and says everything is normal. But you know something isn't right because you are the one living in this body every single day. You know how you feel, and I understand you. And I want you to stay with me for the next few minutes because what I'm going to share with you today is very different from what you have heard before. I'm Dr. Geetha Nagraj. I'm an Ayurveda doctor based in Bangalore with over 20 years of experience working exclusively with women suffering with hormonal issues like PCOS, thyroid, infertility, and other hormonal imbalances. In this video, I want to answer some of the most common questions women ask me in my clinic honestly without any jargon. The most common question I often hear is, Doctor, will what I share with you stay private because my family doesn't know what I am dealing with? So, I want to address this first because for most of you, this is very sensitive. Maybe your husband doesn't fully understand what you are going through. Maybe your in laws keep asking you questions about pregnancy that you are not ready to answer. Maybe you have not told anyone how long you have been struggling with. So let me be very clear, whatever you share with me is between you and me, and your consultation notes are very private. Nobody from your family is ever contacted, and my team handles only your booking. Other health conversation is between me and you. You can speak freely and honestly with me because that honesty is what helps me actually help you. The second question, most women ask me very frequently this question, that is, Doctor, I have tried so many things. I have consulted gynecologist, endocrinologist, I have taken metformin, I have taken pills, and even taken thyroid medication for many years. How is the consultation with you going to be any different? This is a very valid question and you deserve an honest answer. Here is the difference. Most of the treatments you have taken so far were designed to address your symptoms, not the root cause. The pill regulates your cycle, but it does not tell you why your periods became irregular. Metformin regulates your blood sugar, but it does not tell you why your body became insulin resistant. Your thyroid medication replaces the hormone your body isn't producing, but it does not tell you why your thyroid slowed down. When you stop these medications, symptoms return back because your root cause was never addressed. But in your consultation, it is very different. I take a very detailed history. I understand your body, your digestion, your stress cycle, your sleep, your hormonal patterns, because in my 20 years of practice, I have never seen two women with PCOS having same root cause because each body is different and each imbalance is also different. The blood reports which says normal isn't lying, and it is also not telling you the full story. My role is to find the story it isn't telling you and build your treatment plan around that. And one more common question patients ask me is, how long before I actually see results? I'm going to be very honest with you here because you deserve real answers, not promises. For most women dealing with PCOS and irregular periods, you will start noticing changes in 4 to 6 weeks after following the treatment protocol consistently. For thyroid, hormonal markers typically begin shifting in 8 to 12 weeks. For women on fertility journey, we work for a minimum of 3 months because we are addressing your complete hormonal cycle. And real change takes time. But here is what I will tell you in your consultation, your specific timeline, not a general answer. Based on your history, your body, and your condition, I will tell you exactly what to expect and when. Most of my patients ask me this question: will my symptoms come back after I stop the treatment? Every woman who has stopped the pill and watched her PCOS return within a month is asking this question, and it is the right question to ask. Here is the truth: if you suppress a symptom, it returns back when the suppression stops. But when you correct the root cause, the symptom loses its reason to exist. That said, let me be honest with you. Permanence depends on two things: the quality of treatment plan I built for you, and your commitment to follow the diet, lifestyle, and medicines for full 3 months. If you follow these things consistently, what we achieve together is meant to last. This is not a short term fix. This is rebuilding how your body functions. My patients ask me this: Doctor, I'm already taking thyroid medication or metformin. Do I need to stop these medicines before starting your treatment? No, absolutely not. We never ask you to stop any medication without proper medical guidance. Instead, what we do is we work alongside what you are already taking. Once your body starts responding to our treatment, as your hormones starts balancing, as your thyroid starts functioning better, then those conversations about adjusting your medication happen gradually with your doctor's knowledge. You don't need to choose between what you are already doing and what we do together. We build on it. One common doubt my patients ask me is: Doctor, are Ayurvedic medicines safe? Will there be any side effects? I want to answer this with some honesty. Any medicine, whether it is Ayurvedic or allopathy, if taken without understanding your individual body, can cause problem. Even something as simple as wrong herb taken in wrong dosage for wrong consultation can be counterproductive. This is exactly why I do not prescribe generic medicines. After consultation, every recommendation I make is based on your specific history, your body type, and specific condition. I have treated thousands of women over 20 years. The side effect I have seen come from generic one size fits all approaches. But when we prescribe medicines for your body, specifically the right thing in right dosage for right reason, will work with your body, not against it. And finally, what exactly happens in this consultation? Is rupees 499 actually worth it? Let me tell you exactly what happens when you book. First, I listen. It's not a 2-minute appointment where I just glance at your blood report. It's a full detailed conversation about your symptoms, your digestion, your sleep, your stress, and everything. Second, I analyze. I look for the pattern your blood reports aren't showing and the connection between the symptoms that hasn't been explained to you yet. Wait. Third, you leave with a written, clear, personalized treatment plan. Your diet, your lifestyle, your treatment specific to you, not a general printout or general leaflet. A real treatment plan which you can start following immediately. You will not leave that call confused. You will leave with clarity, possibly for the first time in a long time. I have kept this consultation at rupees 499 because I want every woman who is serious about their health to access this without cost being a barrier. If at the end of this session, if you do not receive any value, every rupee comes back to you, no questions asked. I want to speak directly to the women watching this right now. If you are tired of being told your reports are normal, but still you know something isn't right, then this is for you. If you are tired of managing your symptoms for many years and finally you are ready to understand what's actually happening in your body, then this is for you. If you are on a fertility journey and you want a doctor who will look at the full picture, not just one test results, then this is for you. If you have a thyroid condition but still you are feeling exhausted, foggy, and unlike yourself even after taking thyroid medication, then this is for you. Scroll down and book your consultation right now. I personally take every single session, so slots are genuinely limited each week. When they are gone, they are gone. Your body is not broken, it has not failed you. It has been just waiting for the right plan. Let's see inside.